Right now, we have more on the COVID-19 vaccine. The San Francisco Department of Public Health is offering a supplemental dose of the vaccine to some people who've already received that single-dose J&J vaccine. It comes despite CDC policy advising against any of this. People there need their doctor's consent to get a supplemental dose of the Moderna or Pfizer vaccine. And joining us this afternoon to talk more about this is Dr. Lisa Kuchara. She's a professor of biomedical sciences at Quinnipiac University and a frequent guest, a friend of our afternoon newscast. Hi, Lisa. Good to see you again.
Yeah, thank you for having me back.
So I got to tell you, this is so confusing because we've talked a lot about these booster shots and perhaps the need for them. San Francisco is calling these supplemental shots, not booster shots. So what's the difference here? Do you know what's going on?
So from an immune system point of view, there's no difference. So a supplemental shot or a booster shot are just two different names. I think they're trying to use that term to be able to say that if a particular person goes to their doctor and their doctor feels that it's warranted, and that's why they're kind of calling it supplemental. But it still goes kind of against the EAU. So we have, emergency authorization that's very specific of what these vaccines can be used for. I don't think it's unreasonable that somebody that got Johnson & Johnson and is worried about perhaps less efficacy, especially with all the talk of Delta, or somebody that's immunocompromised to, desire this. But I think we really have to let policy be dictated by science and by what's going on as far as that goes.
Well, they would obviously have two different brands in them. And, we were talking about this before. So like I have Moderna. If there's another round of shots, am I going to have Moderna myself? I know that that's something they're still trying to figure out. But in this case, if they have J&J, they'd have a different one, Pfizer or Moderna. Is that even safe?
So it is safe from an immune point of view. I mean, there haven't been studies done, and we always want, again, science to dictate the policy. But in Europe, there have been people who got AstraZeneca. They were at higher risk for a clotting event, so they got actually a booster with one of the RNA. So there's been very small, isolated studies being done with, kind of hundreds of people, not the big scale experiments that we would want to, verify that this is safe. But from an immune point of view, we encounter antigens, germs, over and over and over again, and our immune system is very well equipped to be able to handle it.
Well, I don't mean to put you on the spot because we're talking so much about this Delta variant these days, but there's a lot of talk online and in different articles about the lambda variant and all these other things. I mean, should we be concerned about what's happening around the world right now with these other strains?
So I think we should be. I mean, the new variants are happening in unvaccinated people. They're not occurring in vaccinated people. So we have to look not just at how many people in the United States are getting vaccinated, but how many people worldwide are getting vaccinated. And I think that's where the CDC and the WHO says, let's not be giving boosters right now when we need to be able to get everybody their first set of immunity before that. So I think the variants are concerning. It's why we want to make sure everybody is vaccinated so these variants do not occur. The lambda variant is very concerning for the one particular vaccine that was distributed in China. So right now it seems to have a little bit less efficacy for the three that are approved here, but not something that's really worrisome. But, what's next? What's that next variant that's coming? The sooner we can get everybody to be immune, the sooner we stop making variant-producing machines in unvaccinated people.
All right. Very important note right there. Lisa, good to see you again. Thank you very much for joining us this afternoon.
Thank
we
you.
Appreciate it. We'll see you soon.